It's my pleasure to moderate the session, and our first speaker is Yuthar, who will be talking to us about the role of patients in time and peace, and in times of peace and crisis, from self-empowerment to social mobilization.
Bismillahir Rahmanir Rahim. Excellencies, ladies and gentlemen, Assalamu alaikum. I'm very honored to be able to share my experiences with you today. I would like to begin by thanking the organizers of the World Hospital Congress for putting together this prestigious event. My thanks to His Excellency, the Undersecretary Dr. Ali Al-Hinai and Dr. Honorary Al Rawahy for recommending I engage with this portion of the conference. When I looked into the program, I wondered how to best frame my experience with civil society work to fit the main theme of this Congress. A lot comes to mind when you hear the word hospital. I think it is fair to say the majority of people associate the word itself with sickness and dread. But the truth is, alongside the toil, many beautiful things happen every day at hospitals. People are healed, babies are born, there's a joy alongside the pain. While preparing for this talk, I realized the best I can do today is talk about my experience with hospital first, from the perspective of a patient, a client of the system as it were, and then as a champion of patient advocacy, someone who complements his services, working both with the service provider, doctors and nurses, and the recipient, the patient themselves. I went through 48 years of my life engaging with hospitals as the average person does, get broken bones fixed, gave birth to my 5 children, visited friends and relatives. I did work for 10 years as a medical education at Sultan Qaboos University at the medical college. And yes, I married a doctor. And his life, of course, put the hospital very much at the center of our lives. Nonetheless, my engagement remained either second-hand or at best superficial. In 1998, that changed. I was diagnosed with thyroid cancer after repeated inconclusive visits to my doctor that spanned over a period of 4 years. With the diagnosis, I became genuinely and truly an inpatient. We are blessed in Oman. Soon after the Renaissance of 1970, a system was adopted by which whatever medical services are not available to the citizens of Oman, His Majesty's government-sponsored treatment for the patients abroad. Oncology care was not a service provided in hospitals across Oman until 2004 with the establishment of the state-of-the-art, the National Oncology Center at the Royal Hospital, soon after followed by the inauguration of the Oncology Department at the Sultan Qaboos University Hospital. And we moved on from there. Today, these 2 facilities in Muscat remain the sole cancer-providing centers across Sultanate. Soon a new, fully equipped oncology center will be commissioned. So I was fortunate, given the generosity of His Majesty and his people-centric policies, to be sent abroad for treatment. It was, of course, a trying time for me, being away from my young children, and for the extended family too, still quite unfamiliar with the disease itself. At the time, Oman cancer was still very much a taboo, associated solely with imminent death. I was exposed to many aspects of patient care, and more relevantly to this talk today, a patient advocacy network during my initial treatment for the first 3 cancers diagnosed within 3 months. At MD Anderson Hospital, and my latest stint as cancer patient with my 4th cancer at Singapore General Hospital in 2014. My understanding of what it means to be a patient naturally evolved over these multiple experiences. I went from someone who was passively receiving instruction and advice on my treatment plan to taking an active interest in the treatment option available to me and participating in the actual crafting of the treatment protocols along the doctors and nurses, and then eventually becoming a patient advocate and champion, bridging the gaps between the stakeholders and components that make up the healthcare system as it relates to cancer. The word process in the WHO definition of the empowered patient is, in my opinion, the most important. There's an element of self-empowerment, yes, but like everything in life, it is not black and white. It is very much multifaceted and takes time. Information is fundamental. Accurate information, easily accessible, clearly communicated, coupled with a safe space to discuss and explore options and choices, allow patients to make informed decisions about their care. In the Oman Cancer Association, I started early emphasizing the importance of not only having the right information at the right time, but delivered in the right way. This requires health literacy, educating yourself about the diagnosis, whether it is cancer or diabetes, whatever it may be, is crucial. But it also covers the patient's own health history, a doctor's greatest resource in deciding the fastest route to success with any patient is the conversation she has with the patient. Confidence must be built so you feel comfortable asking questions and seeking guidance from your doctor on how to manage your disease, but also knowing how to actively administer your own medication where possible. You have to ask, what is the alternative to an empowered patient and disempowered one? It's logical that you don't want too many cooks in the kitchen. The last thing we want to do is shift responsibility to the patient who is going through his or her own emotional as well as psychological journey. What we are talking about is a situation, regrettably, that occurs all too often in hospitals across the world, where you have patients who are not lacking confidence to speak. Their problem lies in being heard. This must change. We must always remember that when healthcare providers share their current evidence-based clinical advice about treatment options and go over the risks and benefits of each, the patient's preference as well as values are equally important in arriving at a plan. This then must be sustained with a shared approach to decision-making as that plan is adjusted along the way. The rational option is to view the doctor-patient relation as a complementary one. We are to exist in a partnership. No one is disputing that the healthcare profession is the expert in their knowledge of the disease, but more people need to acknowledge that patients are expert by virtue of their experience and living with the disease. There is room for learning when both sides in this relationship share knowledge and experience. You are then able to set the common objective together: getting healthy and staying healthy. Before I conclude this point of self-empowerment, it is important to share that not all patients wish to be empowered, and that is okay. There is a spectrum of interest that must be respected by all involved: the healthcare providers, the patients, their families, and the network of support provided by the government and the private sector or civil society groups. I believe the patient should always be given the opportunity to change their mind about their level of participation in their own journey, wherever feasible. When I found my voice, I felt inspired to share it with others. This is how the Oman Cancer Association came to be. There is no one-size-fits-all. However, I think my journey with establishing Oman's first patient advocacy association is a living, breathing example of what massive role a patient can have with a revolutionary impact on the community level that can be pushed forward to local, regional, and international landscape. In 2004, Oman Cancer Association was the first medical-related registered NGO. I knew what was missing, but I had no blueprint to get it off the ground. We educated ourselves quickly, particularly about the regulations required to set up such an entity as the one we had in mind, legally, officially, and within the guidelines of permissible civil activities. As I mentioned, thankfully, we are blessed in Oman. So we were absolutely clear and remained devoted to this principle. The aim is to complement and support the initiative and facilities provided for by the government. We crystallized our mission, the objective, created a safe platform to talk about cancer, and we identified our immediate priorities: awareness and screening. We set an action plan for achieving our goal of removing stigma associated with cancer and empowering communities across Oman to take their healthcare seriously and educate all stakeholders on how we can all work together for the common national interest. We went to school, colleges, and corporate spaces, normalizing the word cancer, normalizing the conversation about regular assessment and early diagnosis, hammering home the idea of corporate social responsibility. The mobile mammography unit was conceptualized, pitched, realized, and is now a staple service of the association. The socioeconomic burden of cancer was explored, studied, and quantified and measured. Partnerships were entered into with relevant entities such as the Tobacco Society and corporate and private sectors. Branches and OCA centers were established in Sur, Sohar, Ibri, Ibra, Salala, and Awabi to reach to the grassroots of the community. The annual walkathon has become a staple on the calendar of initially 270 people to 8,000 people and growing. Volunteerism became a popular speech I was asked to give at many venues. We were able to recognize the urgent need to support for young cancer patients and their families who resided outside the capital. Dar al-Hanan was born. We appreciated the challenge and we resolved them. Palliative care was identified as a critical need. 360 nurses and 24 physicians were trained and certified, and 55 of them became certified trainers. 50 nurses and doctors from the regions were given similar training. An ultrasound machine was made available to address the challenges facing young breast cancer patients. The newly to be opened Bridging the Gap project, an outpatient daycare rehabilitation center for terminal ill cancer patients and their families. A patient support bank account to support Omanis expatriates during their treatment. I could rattle off the list of OCA achievement and milestone. I could go on about the exciting plans we have in the pipeline. I could outline our humble hopes and dreams and encouragement from the government and private sectors alike. I won't. What I will do is return to the main purpose of my talk today, the patient. During peaceful time, practically all countries deliver a holistic set of health services according to their economic status and human resources. Despite this, the stigma of certain diseases can wreak havoc at the community level in the absence of fundamental civil activities and associations to assist the efforts of the government in providing for the medical and social needs of the populace. Unfortunately, cancer is one of these taboo ailments. No matter the gold or platinum standard of the healthcare service and facilities, no efforts are able to mitigate the gap, sometimes fatal, caused by misinformation or worse, lack of information among communities regarding certain disease. Fear coupled with ignorance can be a deadly combination. It leads to late diagnosis, refusal of certain treatment, rejection of palliation. All these great variables have a multiplier effect, negatively impacting the socioeconomic gains brought about by improved healthcare facilities and provision and the GDP. Without continuous public education and awareness effort, without encouraging patient empowerment in every clinic, hospital, and medical unit, and without clear protocols that allow for sustainable delivery of reliable care to communities nationwide, urban and rural, the patient remains vulnerable despite existing in an environment of peace and security. When we enjoy political and economic stability, the absence of a strong public-private partnership at the national level is manageable to a certain extent. It is not ideal for the patient, however, but the efforts of the government coupled with support from the private sector, perhaps in the form of donation or equipment and funds, can plaster over the major flaws of this model. Self-empowerment is more likely in times of peace, and mobilization faces less challenges. When crisis strikes, however, its form natural or man-made, civil strife or foreign invasion, or even a purely economic disaster, a sudden and complete paradigm shift occur within the country. The demands of the acute healthcare trauma service increase, and the NCDs are less of a priority. As a result, patient care is based on a triage system. For cancer patients, the urgency is often more complex. Without a cancer control in times of peace, cancer control plan in time of peace, the advent of crisis make patient management close to impossible. For this, we supported the healthcare providers within the region and neighbors, especially Yemen, going through crisis to train in palliative care, leadership, research, and patient advocacy in cancer to their staff, and to certify some of them as trainers, which has worked very well, especially with Yemen. To conclude, the impact and power of the patient cannot be underestimated. An ideal world would have nothing but empowered patients, enjoying stress-free, five-star care in stable environment. The reality is not thus. But we see in example across the globe that with their basic needs met and access to care uninterrupted, patients can surprise us all with their strength and resilience, defying all odds. We rely on the grace of God in all things, and we thank the doctors and the nurses in state-of-the-art hospitals to ad hoc emergency tents who are performing miracles day in and day out, often at immense personal sacrifice. I would like to take this opportunity to thank His Majesty. I'd like to take this opportunity to thank His Majesty for his care and full support of his people that has made a great difference within the region. His belief in his people and the full support of his people empowerment, irrespective of the gender, is admirable and has made a great difference. Thank you.